Support for this program is provided by the following.
Hello and welcome to Patient Power in this Partners program. I'm Andrew Shore. Partners is all about us working together on issues that we face in chronic lymphocytic leukemia. And joining me are some wonderful guests, and we're going to be talking about really kind of stress as it relates to CLL. Does it have physical effects? Can we reduce the stress? Can that have a benefit? And we have people who really are living it and thinking about it a lot. Me too, because I was diagnosed in 1996 with CLL. So let's go around the continent, if you will. I want to start in Louisville, Kentucky with Paul Salmon. And Paul is a professor actually at the University of Louisville, right, Paul?
That's right. Mm-hmm. Yeah.
And what's your field? I think it really relates to this.
Well, it's kind of a blend. My primary area is clinical psychology, so I do teaching, research, and community work in that general area with a particular focus on stress and stress management. A number of years ago, I was really fortunate to work and collaborate with Jon Kabat-Zinn, who started a program called Mindfulness-Based Stress Reduction at the University of Massachusetts Medical Center. That was back in 1995, and I was just so taken, so impressed with his work and the work of their clinic that's pretty much been the foundation for everything I've done since.
Well, yeah, but we should mention there's another connection here is about a year ago, Paul, you were told your white count was going up, and guess what? A diagnosis of CLL. So you're living it a little bit now.
Sure, yeah, and I'd have to say that the meditation practice over the years really was a good preparation and a good foundation. I mean, it's really all about facing things as they occur on a moment-by-moment, day-by-day basis, and I think the more present moment focused you can be, it really does have a powerful impact on managing stress.
Well, that's what we're going to talk about. Now, let's go up to Toronto, where an old friend of ours, Mark Silverstein, has been living with CLL since 2010 and has been through it. We should mention Mark Silverstein decided along the way to be trained in psychotherapy and actually counsels people who are dealing with advanced cancer. And Mark, you've been living with it. Just an update from you. Last time we spoke, after many different medicines, you had a transplant, but now you need more treatment, I understand.
Correct. I have to admit, it was a little disappointing that, the potential for cure was there. And right after about a year, my year anniversary after transplant, I started relapsing again. And it was a very big disappointment. But thankfully, prior to transplant, I was on venetoclax, and I did venetoclax, the rituximab, and I stopped it. I didn't get a resistance to it. So we started venetoclax back up again, and thankfully, it is working for me. So,
well, we knock on wood, we sure hope so. And related to your situation, here you are counseling other people, and you've got to have the stress or however you've dealt with it along the way. So we're going to talk about that. Let's go to Ohio State, one of our largest leukemia centers. And there is a professor there, Barbara Anderson, who actually studies all this. And Barbara, this whole connection of stress and illness and hematologic malignancies and CLL, that's your field, right?
Yes, I'm a professor of psychology, and like our colleague here, trained as a clinical psychologist, but have been doing research in cancer for essentially my entire career. And in that, moved into the area not just of stress, but what effects stress may have on other biologic responses such as immunity, and that's certainly important in the context of virtually every cancer there is, as it turns out.
Well, I understand. I mean, I get, as a CLL survivor, if you will, my doctor insists that I get immunoglobulin infusions to boost my immune system every month. This is expensive stuff, like $10,000 a month. So I understand the worry about your immune system, and fortunately I'm doing okay. So just to start with you for a minute, Barbara. So do you believe there's a connection with stress that we have that either led to a trigger of CLL or the effect of CLL?
Well, there's research not just on the blood cancers, but also solid tumors as well. So many studies that people have done things called a meta-analysis. And in those kind of summaries of the literature, there is data that does not support the relationship between stress and the onset of cancer. However, there's very reliable findings across the years, across tumor types, that stress is indeed related to disease progression. And so that we have studied breast cancer patients, currently studying those with lung cancer and CLL patients. And in all of those studies, stress has a really toxic effect in that it is not only biologically, psychologically disruptive when it is occurring at the worst periods, like cancer diagnosis. But it also portends poor quality of life, depressive symptoms, and other kinds of outcomes down the road. And so that is part of what the toxicity of stress is.
Okay. I'll just say, I mean, we all have our own anecdotes, and I know maybe this hasn't been rolled into a clinical study. My diagnosis in 1996, a long time ago, CLL, followed a year when we'd had a lawsuit, frivolous lawsuit, and somebody sued us, and I just felt personally attacked for months and months and months. And then I had a routine blood test, and it showed an elevated white count, and we were off to the races with this condition, CLL, I'd never heard of. Now, whether that has any scientific validity, I don't know. I just know that that was a tough time in my life. We've spoken to other people who've had divorce or lost their job or financial situations. So I don't know, but let's talk more about the managing stress after diagnosis. So Paul, you obviously have studied it, but now you're living with it. So you're in this 1 year watch and wait situation. You were told you had probably this condition you never heard of, CLL. How have you used what you know to minimize stress?
I've done it. I think there's several parts to it. I guess in one way, the initial diagnosis, of course, came as a surprise because, after all, I'd gone in for a routine workup, and in every other respect, everything else was great. All my other numbers were fine, and then it was kind of like, well, we have this one number that just seems to be a little bit out of the ordinary, and maybe we should look into it. And so that was my first kind of inkling, and maybe something that maybe I wondered about a little bit. And I should mention that my father probably may have had CLL. We don't know, but he had elevated white blood cell count for years. So that's kind of, and there are cancers in the family, and I'm very, I take really good care of myself. I work out, I meditate, and do all the right things. And of course, people who are diagnosed with conditions like this often go through an initial phase where they say, well, why me? I mean, I do everything right. I follow all the rules. I eat well, and So in a certain way, I think what's helped me is to become real curious about this and to look for interesting connections that I can make. I can see where you could get into a sense of blame or kind of feeling like somehow you're responsible for what happens. But really at the foundation of the meditation practice of mindfulness, which is based in Buddhism, I think there's kind of a view of the world and a view of how things are that certainly helps me keep things in perspective. I mean,
You seem calm. You seem pretty calm.
Well, I just take great joy and pleasure in what's happening on a moment-by-moment basis. And I think a really important element is I can find my mind. I've been meditating for years, but the essence to me of mindfulness is paying attention to what's going on in the moment and then noticing when you're not in the moment. I mean, that's kind of a critical thing because you can get off wondering about things, predicting and trying to make projections. But when I find myself doing that, I kind of say, okay, back to the breath, back to the moment, and let's just go with that. So that's very helpful.
Mark, you were nodding your head there a minute ago when he was talking about living in the moment. So you've had a roller coaster with CLL.
Absolutely. CLL is my moment to be living in. But yeah, I absolutely agree with everything Paul said.
So how do you do it? I mean, because you're a man who's lived with tremendous uncertainty. We all have uncertainty, and I'm going to ask Barbara about this in a minute. The thing that weighs over me as a cancer patient, 2 blood cancers, because I have myelofibrosis, is uncertainty. But what I know is the now. What about you? How, with this roller coaster, you're on new treatments now after the transplant, which you hope could be curative. How do you manage that?
It is often challenging at times. I honestly, I probably went through a bit of a grieving process after relapsing after the transplant. There was some hope that there was a cure in there. And so I think both my wife and I actually went through a bit of a grieving process through it. Part of it is allowing yourself to go through these things and experiencing them as opposed to suppressing them. But as Paul said, it's the mindfulness. I've taken mindfulness courses, walking, all these things help. Our emotions, I like to believe that we are not our emotions. They don't control us. We can control them if we understand ourselves well enough. We can make different choices to, as mindfulness kind of teaches you something bad, something comes into your head, you put it up there for now, say, I'll get back to it later and come back to the present moment. And that's really the most important thing. I mean, the existential challenge of CLL, especially what I've gone through with 17P and all the treatments and, all the relapses, it is challenging. It is challenging to stay in the moment. But I'm not going to lie, there are times that I'm not in the moment. I'm in the hell of CLL world, so to speak. But it's bringing yourself back as quickly as possible to what matters. And you can't live in the future too much. You can't live in the past because then you're not in the present. And really, the present is all I have, and because I don't know what's going to happen next. And so my need or my motivation to stay in the present is huge. And so anything I can do to manage that is where I focus on.
Right. I remind myself, I don't know about tomorrow, but right now I know about today. Got a great cup of coffee with my family on it, and that's what I know. So, Barbara, there you are at Ohio State, has one of the largest leukemia clinics in the world. People come from all over, and you get people among the patients who come are freaked out. And I get calls like that, and I know you have patients like that. How do you help people get grounded?
No simple answer to that question.
Mm-hmm, sure.
But it's on our end in terms of what we do. We help them process this current experience. we also teach them, help them understand that while stress is really buffeting them right now, that's in many respects a normal response. I mean, they have gotten very bad news, just like you would have for other kind of traumas in one's life. But we can also get ourselves back to our baseline. And we can do that by discovering how stress is, their stressful thoughts, their actions in terms of what are they doing when they are feeling at their worst, what are they not doing, and really what are those bodily sensations that are just kind of firing off, like, stress-related headaches, muscle tension, and so on. So part of it is help them really kind of dissecting, if you will, what stress is like for them, because then we can use that information as a cue to work on how I might respond differently. So we teach them strategies for relaxation. You all have embraced mindfulness. In our work, we've used other strategies like progressive muscle relaxation to physically relax the body, and do that in a way that's kind of portable for people to use. We've also, oftentimes people are at a loss for kind of, I don't know anything about this disease. And so oftentimes, as you all have found, I am sure that information is helpful. But another big piece that is important not only for CLL patients, but all cancer patients, is this thing we call social support. And a big focus of our work has been helping people to not only receive support from others, because that's oftentimes very difficult to do, but also what can they do to ask for support, because people are reluctant to ask as well. But it's looking at their social relationships and helping them to understand how might I enlist the help of significant people in my life. How do I cope with the fact that people's responses to my requests for social support sometimes are optimal, and how to cope with that. But social support is a huge part of what we try to do.
I just want to comment on that one for a second. So the other day, I was invited to have coffee with a gentleman in his 50s who was diagnosed with CLL 4 months ago, is on treatment, and his wife knows, nobody else knows. His teenagers don't know. His wife has 8 siblings, all in the area, big potential support group. Nobody knows. His aging parents don't know. Okay? And we spoke about this burden that he was carrying around by keeping it a secret, right? But he was afraid, Barbara, he was worried about social support. He'd know he'd get it from some people, but he knew they'd get tons of questions and misunderstanding about CLL as a cancer and whether he was going to die tomorrow, So he just, not only did he find it easier just to keep it a secret right now, knowing he had a lot of stress with it, but he was worried about if he told people and sought social support, there'd be a downside as well as an upside. Could you comment on that? Taking that risk.
Well, one of the things we help people to do when thinking about kind of their social life is, in some sense, who's on the page for you? Who are the individuals that you see as being in your social sphere? And then also thinking about, are those individuals that could provide emotional support to me? Are they individuals that are better helping me with things? Because not everybody's good at everything. And so sometimes people misconstrue when, for example, I remember a woman, she says, I have been so difficult with my dad. And what she was realizing was she was expecting that her dad would kind of sit down and talk with her about this experience. But he wasn't a person that did those kinds of things. But he would come over and do anything for her. But she was just able to see that people in my social environment, not everybody's the same, not everybody can do all things, and to be aware of that and not make negative attributions to people when kind of there's a mismatch. But your point about a person trying to kind of control the information, oftentimes that's a product of them trying to control their own emotions. That is not kind of, CLL will be bigger if everybody knows about it kind of thing. And I can only cope with so much right now. So that for some people is just a strategy to, in some sense, control their stress.
I respect people, whatever they say, but Paul, do you tell people or your family, do they know, or how do you feel about just whether it diffuses the CLL or keeping it close controls it?
Well, I think what I'd say is that I'm in kind of an ambiguous state right now, and I'm really not. I haven't lived through this to the extent that, for example, Mark has, and I'm just really, really awed and impressed by Mark, by your courage and your ability to move through this. And I take a certain inspiration from that. I'm sort of selective about how I share this with family, but I'm kind of in the situation of not yet being symptomatic, and so in a way, I haven't really lived the experience of people who are further along. So I guess I'm just sort of judicious about it and don't make a big deal about it. But if somebody asks, or if there's an opportunity that I think would warrant sharing it, I will. Yeah, so I mean, maybe we'll have to check back at some point in the future and see how this goes.
Mark, you've been pretty public about it. So do you take strength from people? Because I'm sure there are people now who say, Mark, how are you? And obviously, and you're taking steroids now and can see the effects of it, and you have certain symptoms you're dealing with. How do you interact with people? And does it give you strength? Or is it a downer? And how do you cope with any of that?
I think it took a while to accept it and accept it as part of who I am at this point. And I went through, as ridiculous as it might sound, I was laid off from work after I came back from chemotherapy, my initial diagnosis. I had to go find another job. And I found in my interviews, I was just crashing and burning because I couldn't talk about why I hadn't worked for several months and why I was off for a year and all this other stuff. And it finally came to terms with the fact that I had to accept it and actually talk about it. And once I did that, I actually ended up with a job. The fact is, it is part of my life. It is what it is. Unfortunately, lots of people, I'm their worst nightmare. Someone with cancer is their worst nightmare. They don't really want to know about it. What they ask is not really specific to the cancer. How are you? Is not really a specific question, cancer-related question. So I actually I wear it. I don't throw it in people's faces, but I wear it, not proudly, but I wear it as, it is part of my life. It's actually part of who I am at this point. And so I don't shy away from it.
Barbara, so Mark runs support groups as well as seeing people privately as a counselor. What about support groups, whether it's informal, like I used to have a group in Seattle where we used to live, and we found ourselves on the internet all diagnosed with CLL, and we actually used to have lunch together, not so much to talk about the CLL, but just to be people. But what about that, getting together with others and talking?
That's very interesting because we ran groups for years. They were with breast cancer patients, and after our part ended, because they were kind of time limited, it was oftentimes the case that women would get together thereafter for lunch, just like you were doing. And people matter. Numbers of people matter. Individuals that are at great risk for their struggle with cancer are those individuals living alone, not having a partner. They're at great risk for poor outcomes, and that's not only from cancer, but you can see that effect across diseases. And so having a confidant doesn't have to be your spouse, but having a confidant is of great benefit in coping with this experience, as you all know. But for those that do not, it's a great loss.
So just to go back to one thing you said earlier, just clinically, the studies you talked about, all these studies that show that when somebody is internalizing a lot of stress, other physical things happen. So it would seem like our message to everyone is having an outlet for this stress, a way to dissipate it, can help you be healthier. You may still have the CLL, but you can be healthier. Did I get that right?
Yes, you did. Yes, you did.
All right. So Paul, to you. So you mentioned meditation and mindfulness. A lot of people aren't familiar with it. I mean, I think of, going like this and closing my, so tell me what your routine is. What's your routine?
When I think about a routine, I think the important thing, routines can become mindless, and I think you have to be a little bit careful about that. But I do think that there's a value in establishing intentions that you follow up on a regular basis. I think an important aspect of meditation is that it's not really just a solitary activity. And in fact, one of the core elements of a mindfulness practice is connecting with other people. And there's a word for that. It's called Sangha. It means connecting with a group of like-minded individuals. And I would say that's one of the most vital aspects of having a meditation practice. I mean, you can do a certain amount on your own, and I think that makes sense, but it's really connecting up with other people. On the mindfulness groups that I've run, I think maybe Barbara or Phil mentioned that in the aftermath of these groups, people start forming their own subgroups and start getting together. And you've mentioned already that there's a very important social component. So for people who feel like meditation is kind of just staring at your navel and sitting in the full lotus position, I mean, that's just the that's the Madison Avenue aspect of it, and it's a much deeper way of connecting with other people. And I really feel one of the key elements here is a sense of gratitude. You put your own experience in the context of other people, and you really can be grateful for how things are and what you have. So that to me is one of the most vital aspects of meditation practice. It's being grateful for being alive and having this moment to really treasure. So in regard to social support, of course, I've been talking a lot about meditation and mindfulness and how valuable that is. But I do want to say at a personal level, my partner, spouse, Susan Matarese, has just been wonderful in terms of offering support with this early stage in the process, the initial diagnosis. It certainly was stressful for both of us. She's a university professor also, and of course, has a very busy life, but I've always felt fully supported, and I just really am not sure how I'd be handling this absent her constant reassurance and kind of help in going through this process. So I think it's always helpful when you have somebody to bear your burdens and share the joys of life too. So I'm approaching this both as a professional who does a lot of work with stress reduction, but also as somebody who is fully aware and acknowledges the importance of having other people with you. So my situation is an interesting one because I'm sort of straddling the fence of being an academician, but at the same time going through this journey. And at this point, at the early stage, but once again, just to emphasize the importance of sharing this journey with someone else, and certainly want to acknowledge Susan's support through this process.
Mark, you lead groups in Toronto, so is this part of it?
From my perspective, it's almost like it's you're a bit of a Martian when you get a diagnosis of cancer. You're almost cleaved off of society in some ways. Your experience becomes different in some way. So being in a group situation where everyone's going through the same thing, it's very validating. You speak the same language, no matter how close the people around you, your family or everyone is, unless they've gone through it, they don't quite understand what you're going through. As much as they may like to, they can't quite grasp the entirety of the diagnosis and the experience. And so I truly believe that, a group situation is ideal to be able to just not feel alone, not feel like all the things that you're experiencing and all the things that you feel or are thinking, they're not different than other people. There's shades of it, and differences, but the fact is the fears are there, the stresses are there, the challenges, the social challenges are there. The sense of, our culture is very productive, very goal oriented and being productive. And so when you're diagnosed with cancer and all of a sudden you're in treatment and you're off for a year or so, and you're not being productive and you can't do what you need to in the house, and you're not bringing money in and all that stuff, it is a very challenging thing, for your sense of being. And so being able to talk to other people and understanding that that's a normal sort of sense of being within the scope of the diagnosis or treatment, I think is really important. And it's very validating. And I agree. Almost every group that we've run, the people afterwards, the individuals get together on their own and have lunches and go for walks and stuff like that. Once again, it's like the Mickey Mouse Club. It's a club for you, and everyone gets it within the club. And so I think it's very, if you can get into a support group, I think it's very important, and I think it's very beneficial.
Well, I agree. But Barbara, I want to turn this around for a second. So you mentioned some people live alone, and certainly with the average age of CLL diagnosis being 72, some people may have a spouse or partner, but they may not. But when we do have somebody perhaps living with us, sometimes even if we manage our stress, they're not managing theirs, and that's stressful for us. So any tips for in these relationships we have where we can have strength from support, and particularly if it's somebody very close to us that we can't push away, how we can have them see that they're sort of stressed out themselves and stress producing for us?
And I think that, the core of any kind of couple issue is communicating, and communicating about that fact as well. I mean, it's also the case that, caregivers, partners, they can simply be burnt out, and that can happen in part if people kind of only rely on their spouse, that there's no know additional people there to support them as well. And so kind of both the individual with cancer as well as the partner need other contacts, kind of need safety valves other than each other in the system, because they have their own support needs. They have their own issues to cope with, along with the worries that they have about you. And those are potentially difficult conversations, but can come from the standpoint of how can the two of us kind of rely on each other, but how can we also receive support and help from others that may be helpful to us apart from each other. It's just, that's, communication is the basis of couples coping with any problem, including that for cancer.
Right. I think that's true. I know it's been true. We've been married 33 years and 23 years with CLL. And Esther, I know, speaks with others independent of me. And just what you were saying, Mark, and Paul, is I've gone to certain groups myself, only patients, and we can talk turkey, if you will, because we all have that Purple Heart of the diagnosis, and there's a lot of stuff we get that maybe somebody else wouldn't. One thing about couples, though, Mark, I've met your wife a couple of times, Nelia, and I've spoken to her and we've talked about this. So does she, you've been through the ringer and she has too with it. Does she seek outside support herself?
Absolutely. And she actually started a program for care partners herself at our local library to try to give back and help. I think I totally agree with everything said. It's extremely stressful, I'm sure, for her, even though I'm the one, the existential sort of threat hanging over me. She has to live with watching me go through that, and watching someone you love go through that is an extremely stressful event. And, after 9 years and the ups and downs we've been through, I'm sure she's a little burnt out from the whole thing too. I know I am. I'd like to put a rest to it for a while, but I have no doubt she would like to too. It's very challenging. I totally agree that, whether it's other people, I see a psychiatrist who specializes in chronic cancers. I know Nelia's seen other psychotherapists and talk to other people. It's extremely important to share things. And it's also important for the two of you to share things. I think, Andrew, we've talked about, maybe I'm afraid that, I'm afraid about something. Let's say we're going for a test, and I have a lot of fear built up around the results of that test, and Nelia does too. And if we talk, and I don't want to tell her say something because I don't want to freak her out even more than I think she's already freaked out, and vice versa. But in the end, we end up in conflict because we have so much energy and stress built up that you end up in conflict over it. And so we learned the hard way at the beginning to really try to express ourselves, not kind of be concerned whether am I going to overwhelm her or is she going to overwhelm me with her fears or with my fears. Let's talk about it. And we probably share some similar fears. And in that way, it alleviates potential conflict as well. And it also puts you guys on the same page. And it becomes a little more of a shared experience. And I think that's a really important part of it too. So.
Amen. Paul, so you're a runner. I do some running, and I used to run marathons, and I certainly can't anymore. Mm-hmm. And I do some biking as well, and I try to do some exercise because I know that's stress reduction for me, and I bet it is for you. But if your CLL progresses, and it doesn't progress in everybody, we should say, but if it progresses, and you can't run 15, 20 miles a week, you can run less. Is that okay?
I think my intention really is to be as healthy as I can, whatever circumstances I'm facing. And, I've heard people say, well, why put yourself through all of this in terms of exercising? And, in the long run, something's going to get all of us eventually. But the fact is that the running that I do now is the source of great pleasure and enjoyment. And I don't run as fast or as far now as I did 10 years ago, but I'm not really troubled by that because I find a lot of satisfaction in going out for a run or doing yoga or whatever else that I do. It really does come down to, what's happening now and not getting caught up thinking about the future. It's not that I don't think about the future, but it's just there's a lot more pleasure to be derived and gratitude really in staying with things the way they are.
Barbara, we're on the right track for you. I mean, you do this all the time. We've talked about meditation, we've talked about group, we've talked about couples, even couples communications, couples therapy, we've talked about exercise. We haven't really talked about diet. I know stress can be something where people overeat. So, but we are in the right track with helping us so that, first of all, we live for today and we don't have a cascade of other health problems that may follow.
Right. And no, I mean, you are right there in the core of what can be helpful to people. That is, choosing what works for you in terms of reducing stress, whatever way that can be it a 30-mile bike ride or something different, but certainly making an intentional choice to do something to reduce your stress, and do that actively. And the other piece is that of social support. I mean, hugely important to help not just your management of the disease, but really going through the experience, kind of being emotionally fulfilled and connected with other people, because that gives people great joy, great fulfillment, a sense of connection, and a sense of this is me too. This is not just cancer, but this is all that comes with being in a social place.
I want to just, in this internet age, just make one comment for people to be aware of, and that is, in social media in particular, people are going to post all sorts of things. And when we talk about CLL, it is very variable. Here you have me. I had a 17-year remission from my initial treatment. Mark didn't have anything like that. Paul's in watching it. Wait, we're all over the place. And how we react to the different medicines may vary greatly. And now we're looking at what genes are active in your cancer and what's your situation at that time. So you need a filter for what people are posting, or even maybe in a support group to know, is that my situation too? Maybe not quite. Maybe that's not my journey. That's their journey, but that even within CLL. So I think we have to keep that in mind. I don't want to say you need a thick skin, but you need to be savvy and understand the variability of these conditions. But that said, there's a lot of strength you can get from people who do want to support you. And I want to thank you guys for being with us today. So Barbara, just a final comment from you. And then I want to go around with Paul and Mark. So stress is real and we need to pay attention to it, right?
Very much so. Very much so.
Okay. But if we do, with some of these strategies we talked about, we may not be cured, but we can do better.
Of course. Yes, exactly. That's exactly the case.
Okay. Well, I want to thank you for the work you do at Ohio State. It's a major center for what we've got, CLL, and I know you see lots of people there. And I want to thank you for your devotion over your whole career to this.
Thank you.
Thank you. And Paul, you're in this field too, but now you're living it, at least with a diagnosis that hopefully is the doctors like to say, indolent.
I've heard that word.
Yeah, hope so. But I want to thank you. And I know there's uncertainty, but it doesn't sound like you're troubled by that.
Well, I try not to get too distressed about being troubled, if that makes any sense. I mean, stress is a part of life. I mean, it makes sense to say you can reduce it, but it's there. There's a quick just little quote that I put on every email attributed to Arthur Ashe, the wonderful tennis player who eventually succumbed to HIV because of a transfusion. But he said, start where you are, use what you've got, and do what you can. And I just find that to be just something that I go back to time and time again.
Well, we wish you all the best. Thank you for your work you do at the University of Louisville. So we got Ohio State, University of Louisville. Let's go up to Toronto. So Mark, I hope we're going to get to talk for a long time.
I hope so too.
And
I really do.
Nobody knows, for you, for me, for any of us. But I just think, the way you're approaching it and your wife, Nelia, is so healthy. I know it's not always, there have been highs and lows, but hopefully medical science can stay ahead of your CLL. And but just great strength to you, Mark. We wish you all the best.
Thank you so much. Thanks, Andrew.
Okay, well, this is our partners program. Here we are. Barbara's in clinical practice. She's our partner today, and for many people, and Paul in Louisville, and Mark, and three of us living with CLL. And wherever you are, follow these tips, okay? There's some great ones, and we always appreciate your suggestions. Paul had written into us at Patient Power and said, I want to help, and here he is. So thanks so much. In California with my friends in Louisville, Kentucky, and Toronto, and up in Columbus, Ohio, I'm Andrew Shore. Remember, knowledge can be the best medicine of all. We wish you well.